Assalamualaikum and hi everyone. I am DHANIYAH binti MATUDIN, and in this video, I would like to talk about dermatology. So this is the content of this video, which is Introduction to Dermatology, the integumentary system, anatomy of the skin, a disease and its treatment, and also the expert in the field. So now, let us move on to our topic. What is dermatology? Dermatology is a branch of medicine concerned with the diagnosis and treatments of diseases related to the skin, hair, and nails, both in children and also adults. Dermatology mainly focuses on the skin, and the specialist in dermatology is called dermatologist. Now, let us take a look at the system related to dermatology, which is the integumentary system. So what is integumentary system? It is the set of organs that forms the external covering of the body. It is also referred to as the body's outer protective covering. The integumentary system is made up of skin, hair, nails, glands, and also nerves. The integumentary system has a few functions, which is it provides protection for the body from physical damage, chemicals, and also pathogen. It acts as the first line defense of the body. Next, integumentary system also involved in thermoregulation, where it can control body temperature through sweating and also blood flow. The integumentary system is also involved in the excretion of waste products through the glands in the skin. The example of waste products are salts and also small metabolic waste. And lastly, integumentary system detect and also transmit sensation like touch, pain, and also temperature. Next, we move on to the anatomy of the skin. Skin is the largest organ by surface area that consists of three main layers, which is the epidermis, the outermost layer of the skin. The middle layer of the skin is called dermis, and also the deepest layer, which is hypodermis, that lie just above the muscle layer. Now let us take a look briefly at each layer of the skin. So the first layer of the skin is called the epidermis, which is the outermost layer of the skin. It is a keratinized epithelium, and this feature provides protections, strength, and also waterproofing of the skin. The epidermis again consists of 5 layers, which is stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and also stratum basale. From the picture, we know that the epidermis is avascular, which is lack of blood vessel. The next layer of the skin is the dermis. The dermis lies just beneath the epidermis, and it is a tough and collagen-rich layer, which provides the skin with structure, elasticity, and also strength. So the dermis is made up of connective tissues, nerves, glands, hair follicles, and also in the dermis we can start to find the blood vessels. The last layer of the skin, which is the deepest layer, is the hypodermis, or also known as subcutaneous layer. Since the hypodermis consists of mainly connective tissues and also fat cells, which is adipocytes, the hypodermis acts as insulator and it also absorbs shocks. And also in the hypodermis, we can find blood vessels and nerves. Next, let us move on to the disease related to the integumentary system, which is atopic dermatitis. Atopic dermatitis is a type of skin condition that causes dry, itchy, and also inflamed skin. Atopic dermatitis can start earlier at age, even during infancy, and it can also last until adulthood. Atopic dermatitis can develop in the skin where the skin typically bends or flexes, so such as the hands and fingers, feet and toes, arms, and also the legs. So what are the symptoms and causes of atopic dermatitis? Now, the symptoms and causes of atopic dermatitis may differ following each patient. Some of the symptoms may include dry and cracked skin, itchiness, and also appearances of rashes, small fluid-filled bumps on the surface of the skin or the epidermis. Furthermore, some swelling and inflammation may also occur on the skin. So what are the causes of atopic dermatitis? The causes of atopic dermatitis is mainly because of damaged skin barrier, which make the skin vulnerable and sensitive to irritants, allergens, and also environmental factors such as pollen or even heat and cold. So this is how atopic dermatitis can look like on a patient. So in the first picture, we can see that the red rashes started to appear on the skin of the patient. And also on the second picture, we can see how atopic dermatitis affect the area of the skin where the skin typically flexes or bends, such as the elbow and also the armpit. Now we know the symptoms and causes of atopic dermatitis. So, what is the treatment for this disease? Meanwhile, there is no cure for atopic dermatitis. The treatment is focused on management of the symptoms, and it is mainly to reduce the inflammation, relieve the itchiness, and also to prevent flare-ups. So some of the treatment include topical steroid creams, which is to reduce inflammation and flare-ups. Some oral medication are also used, such as antihistamines, to reduce the reactions towards allergens. Moreover, moisturizers are also used to prevent dry skin, and anti-itch cream is used to relieve itchiness. Next, I would like to talk about two experts in this field. The first person is Dr. Nazirin Arifin. She is a dermatologist that earned her diploma degree in dermatology in 2005. And also 2 years later, she acquired a master's degree in clinical dermatology from St. John's Institute of Dermatology. Now, she offers her service at Nazirin Skin Clinic alongside with other colleagues. The next dermatologist is Dr. Melinda Tong. She earned her degree in Bachelor of Medicine, Bachelor of Surgery at University of Sydney, Australia. Then, continuing a specialist degree in dermatology. And also now, she opened a specialist skin clinic in Kota Kinabalu and becoming a visiting doctor in KPJ Sabah Specialist Hospital. So that's all from me. Thank you.